Hello, I am Dr. Joy.M.Thomas, a consultant cardiologist and interventional cardiologist and electrophysiologist at Sundaram Medical Foundation, Anna Nagar. Now, what is sudden cardiac arrest? Sudden cardiac arrest is not the same as heart attack. In a patient with a heart attack, it is the blood vessels to the heart that is blocked. But in a patient with sudden cardiac arrest, or what is called sudden death when it occurs, it's because of irregular or fast heartbeat that occurs because of electrical problems within the heart. And these are found most commonly in patients who have a weak heart. And the commonest cause of a weak heart is heart attack or reduction of blood flow to the heart, which occurs over a period of time, what is known as chronic ischemia. So, in order to maintain a good pumping capacity, it's important for the blood flow to be maintained, and that is where coronary angiography and all these investigations become important. Now, what is sudden cardiac arrest? Sudden cardiac arrest occurs because of the heart suddenly beating fast. A normal beat that keeps on going at a regular rhythm of about 60 to 100 beats per minute, suddenly, because of some reasons, earlier I mentioned about severe heart failure. So, if the heart pumping capacity is reduced, these patients may suddenly go in for a very fast heartbeat, and this causes a fall in the blood pressure, and by that, the patient can go in for a sudden death. It happens also in patients who are perfectly normal athletes who do a marathon. Some of them might not have had necessary training and the knowledge about how to go about the marathon. And you could have seen of patients, I shouldn't say patient, athletes who are in the prime of life. For example, football. There was a captain of a European football team who collapsed and died on the football ground. And similarly, marathon runners, cyclists, all these people collapsing and dying suddenly in the prime of their health, people with very good physics and absolutely normal ECG's echo. So these are because of ionic changes that happen in the muscles during endurance. So it's important to understand that if being healthy alone is not a guarantee that you cannot have a cardiac arrest, it should be a good history has to be gone into whether you have had sudden death in your family, do an ECG, do an echo, blood test and all that, and ensure that you're reasonably safe before you go in for endurance sports like a marathon or long distance cycling, etc. Imagine a person at the age of 40 or 30s dying of sudden cardiac arrest. It is really a horrific incident in such cases. So we have to make sure that any person going for any sports should be thoroughly screened. Not only that, even normal people who are leading normal lives and going to work every day, once they are above the age of 30 or 35, should undergo a master checkup, do an ECG, echo, treadmill and other tests and find out about how good their heart is and whether they are at danger of sudden cardiac arrest. So thank you very much.